and welcome back to Talking Mental Health. This is episode 5. Talking Mental Health is a video podcast where I talk to college-aging adults on all things mental health and wellness. As I've talked about before, this is a part 2 to season 1. So in the part 1 episode that took place in season 1, I talked to Dr. Mitchell, who is an assistant professor and clinical director at Jacksonville University in the Department of Clinical Mental Health Counseling on cross-cultural counseling. So I have Tess here today, and Tess and I are going to talk about things that resonated with us, how we've experienced these in our own lives, just all of our thoughts on the original episode from part 1. So Tess, Tess has been on an episode before, but just in case you're new here, Tess, if you don't mind giving a little introduction as to who you are.
Absolutely. So my name is Tess. I'm a junior at the University of Florida studying business, and I am one of the Studio Wesley interns this semester.
Tess has been on the show before, but she's here for a return episode a second time. If you're ready, Tess, we can go ahead and get going.
Let's do it.
Yeah, so I'm curious, just out of everything, what's the first thing that stood out to you in this episode?
I think the first thing that really stood out to me, and it definitely framed the way I saw the rest of the episode, was when she started off talking about how cross-cultural, I think a lot of us think of culture as like a very specific thing, but she gave it a much wider view and was like, no, culture can be age, it can be race, it can be background, it can be gender, like any of these different things can lead you to have a different culture than someone else, which can then impact a relationship with a counselor. So that was the first thing that really stood out to me, was that distinction between like how I used to see culture versus then like taking on her perspective and how that influenced the rest of the video.
Yeah. And I think too, it goes into that, how she talked about like, anytime you're in a counseling session, it's going to be cross-cultural counseling. And that hit me because, I've mentioned it before, I'm a social work student, and we talk about this kind of stuff all the time in the social work program where like, they tell us not to use the phrase, I understand, because in theory, you have never walked in that person's shoes. Two people have never lived the exact same life. And so we don't understand everything they've gone through. And I feel like that goes into along those lines of what she was saying, where like, it's all cross-cultural. There are similarities between people in those rooms. There are differences, but no two people are going to be exactly the same, which makes it all cross-cultural, which again, like same thing you said it, like she said it and I was like, that's interesting. Like taking into account all of those pieces, not just race and ethnicity and the way you were raised, but like everything is cultural, which I definitely thought was really neat.
Yeah, no, I totally agree. And it made me reflect back on like counselors I've had in the past and some of the demographics that I've like connected with them on. And I was thinking, even like when I was younger, I was like, of course it's cross-cultural because I'm talking to someone who's 20, 30 years older than me. Like there's no way that we're going to really deeply understand each other or be able to relate, versus the counselor I'm seeing now who's only a few years older than me. And there's a much deeper, just like, I know that she understand. I know. Now I'm like, afraid to use the word understands, but she like sees some of the things that I'm going through and I guess can relate to them. Doesn't necessarily understand them, but can relate to them more so than someone who's a lot older than me.
Yeah. And I think that word too, that I know I said that thing about the word understand, I think it's a part of like everyday vocabulary and everyone uses it. It's just like as social work students, they're like, try not to use that. Because if you have someone going through something really big and they're coming to you for it, and you're like, yeah, I understand, because you don't. But I think in like other senses, it's okay to use the word. But yeah, I mean, especially that age thing. So, younger children who are in therapy, no matter whether it's like play therapy or they're sitting there talking to a therapist, that's definitely cross-cultural. That therapist has gone through school, has gotten their degrees and their licensure, and you might be looking at a 9-year-old having a conversation with them. And that is two totally different things going on. I'm trying to think. And I mentioned, I don't know what I mentioned. I don't know where I was going with that. My brain just kind of took a step back for a second there, but it's okay.
It's okay.
Yeah, I really enjoyed a lot of that, of like kind of taking us and pulling us back and seeing the bigger perspective of it. And then I'm curious too, because after that, I kind of asked her, I don't remember what words I used, but I remember at the time that I was trying to get into the topic of therapist shopping. And I can't remember if I used that phrase in the episode or not, but
I don't think you did, but I know what you're talking about.
Yeah,
that was like another thing that I noted was just so as you were talking, she started saying something along the lines of like, you kind of have to try out more than one in order to learn what you do and don't like. And I was like, that's just life. Like, that is how friends works. That's how like dating works. It's like,
Yeah.
it makes total sense that that's how therapist works too.
Yeah, and if I think it's just like a barrier for sometimes for some people because they're like, what if I go to therapy and I don't click, what if I don't feel like sharing with that person? What if I don't feel better after my sessions? And I'm like, that's when you try someone else. Like that is totally okay. And I think that sometimes that's not made as known as it should be. Like you can go to a therapist, you can go to one session and say, no, thank you, I was uncomfortable, and go somewhere else until you find the right fit. Like that is totally okay. And so I was kind of approaching that topic with her a little bit because I was curious when it gets into that cross-cultural counseling, to say you're sitting in a room with someone and you say something about the way you grew up or the culture or something that you have going on that they don't identify with, and maybe it's uncomfortable. Maybe it didn't go the way you wanted it to. Like, what does that look like? And so I don't know. I just love that conversation of like, you can therapist shop. That is totally okay. Find someone who works for you. Like, it's your mental health.
100%.
It's so important.
Yeah. And I feel like even sometimes there's like nothing that they objectively did that even made you feel uncomfortable. And you're like, we just don't click. We just don't click. And you just have to try someone else. But I do think for people who may go into it initially being nervous about it, like that not clicking, they're like, I'm done. I'm done. I don't want to do it.
Yeah.
And so I'm glad that you did touch on that. That both of you touched on that in the first episode of like, it's okay to do it. In fact, it's good to do it.
Mm-hmm. Yeah. And I think what you just said there, like, you go into the room and you're like, I don't know why, but I'm not going to do it again. And so that's why I think it's important to talk about it, because like getting that initial appointment is a big step to begin with. Going into therapy for the first time is a big step. But not like having that awareness that like maybe it doesn't go well. And what do you do when that happens? I think that's also big. Because you don't want that one session, and for like you said, there may not be any reason you can think of why that didn't go well, but you don't have to stay with that therapist. You don't need a reason. They don't need a reason to terminate that relationship. And so not only did you take that big first step to go to therapy, but also understanding like what else is available, I think is super important, and having like all of that stuff. I think that's where I was trying to get to.
Yeah. And I think I touched on this a little bit in the first episode I was on this season, but like there are a lot of things about UF's counseling and wellness like offerings that frustrate me, but there's also a lot of things that I appreciate. And one of them is that like every new student who comes in, rather than just immediately getting paired with like the first available counselor or something like that, you have a one-on-one, I forget what they call it, but essentially like an assessment, and they go through, what things are you looking for help in therapy, and a lot of talk about yourself, but also like, what are you looking for in a counselor? Do you have a gender preference? Do you have a racial preference? Do you have a background preference? Do you prioritize like having so like for me it was like, do you prefer to have a female counselor even if there's a male counselor who's more skilled in your specific area? Like all of these questions so it really felt like they were trying to find someone who would be a good match for me rather than just like throwing me in the room with someone.
That's really neat. And because they do that kind of stuff in like non-campus related mental health offices, and so I think that's really neat that they're doing it on campus too, because it's an overall evaluation is what it is of like services and stuff. And I think that is neat because one of the things she said in this video was stay open to the process, and I think that makes it more helpful to being open to the process. Like having someone say, you're are you comfortable with a male therapist? Is that comfortable for you? And I honestly I think that should apply to like all professionals in all fields, being asked that question. 100%. But that's a whole different topic and a whole different podcast. But that's really neat. And I'm really glad that that's a part of their, I've said process like 50 times in the last 2 seconds, but that's the only word I can think of. Model. That's a good one. I was sitting here and I was like, I don't know if I can say that again. But I think it's a really neat part of their process. And I definitely wish more campuses did stuff like that. But again, I don't know a lot. I mean, I know what campuses have services, but I don't know how all of them run, because that's something that's hard to know unless you're on that campus.
Exactly.
Yeah. So very cool. I'm trying to think some other things from this episode. I know there was a point where she was talking about destigmatization for different
Mhm.
communities, races, and ethnicities. I'm curious, did you have any thoughts along those lines, or?
Yeah, so what came to mind in that section was I actually had this conversation with not the psychologist, but the psychiatrist that I started seeing this summer. And we had a conversation about how she has faced a lot of pushback, actually from the Christian community about just,
Mm,
especially when she started studying psychiatry back in the 90s, she was like, a lot of people were like, we shouldn't be prescribing medication for that. Like,
mm-hmm.
we shouldn't be doing it. This is a very human thing. People need to work it out on their own. And she, specifically to the Christian community, she's like, well, if God gave us these tools to be able to help people live their lives better or easier, like why would we not do that? She's like, why would I
Yeah.
not spend all of these years in med school learning how to prescribe or like which medications to prescribe and what they do for people? And so it's just a really interesting conversation to have with her and like a really interesting perspective of not only, and it's similar I think for people who do take medication for mental health, but also like the provider side gets a little bit of pushback too, and that was really interesting. And so I think
Yeah.
that destigmatization piece is so important because it's like counseling or medication or any sort of mental health treatment, it's really no different than like typical Western medicine. Like if you have the flu, you're going to go get treatment for it. Like
Mm-hmm.
it's no different. And I do think there's been a lot of progress in kind of leveling that out, but there's definitely still some stigma. There's still some progress that can be made.
Yeah. Well, I'm so glad I asked you about this part of the podcast because there was so much there that I like want to pull out. First of all, I loved that phrase of like, God gave us these tools, so why wouldn't we use them? Because I feel
Exactly.
like you said, we do apply that to Western medicine and things like that. Why can't we apply it to mental health? Why is that an issue? And it's just like a lot of what the Wellness Project aims to do is to find that cross between mental health and religion, because there are, not all church communities, like you said, we have come a long way. But there still are,
Mhm.
Christian communities where people find themselves not able to talk about their mental health because it's just not something
Yeah.
we do in those spaces. Um,
Well, and there's so much talk of just like, just pray about it. Like, just pray
yeah,
about it and things will get better.
yeah, yeah. And I appreciate you going there and naming that. Because it is, like you said, there's so many different cultures, there's so many different pieces to culture, and that is a piece of it. That is a difference in culture for some people, on whether or not they
Mhm.
take that step and they seek therapy or psychiatry or whatever it is they need at the time. um, and I'm gonna name it again, I loved that. Why did God give us these tools if we weren't supposed to use them? um,
Exactly.
Very cool. And I think it goes along those lines too, of like, so she was talking more of like race and ethnicity, but obviously there's all this crossover to different cultures, of like having those conversations, talk about how it's okay to seek services. You're not crazy if you seek services. There's nothing wrong with you if you're seeking services. Do the thing, like have those conversations in those spaces that you don't normally have those conversations in. It's
Yeah.
talking about spiritual trauma in a church place, a place that in theory some of them might not want to talk about mental health at all, but then you're like, not only are we going to talk about mental health, but let's talk about what has happened to me in the church in my past, or what's happening to me
Exactly.
currently in church, like just things like
Yeah.
that. So yeah, gosh, so many things there. Is there anything else that stood out to you from this podcast?
Something like that you said a minute ago that
Oh yeah.
really resonated was like another piece of culture is also just like gender and how the I feel like the stigma changes based on your gender because like
Mm-hmm.
guys going to therapy is definitely a lot, like I don't hear about
Yeah.
that anywhere near as often. I feel like they get a lot more pushback, whether it's like parents or just the public in general, of like, you don't need that, like you're a macho man, you don't need to go talk about your feelings.
Mm-hmm.
um but like everyone should go to therapy. Therapy is so good, and just
Yeah.
having an open space to talk about things with no judgment, like that's that has no discrimination between genders. Like everyone needs that space to do that. Um,
Yeah.
And that's like, I do think that stigma as well has improved a little bit, but it's definitely still there.
Mm-hmm. Yeah, and I appreciate you bringing up this part too, or that like aspect of it. Because just like obviously I don't know any of the statistics or any of the numbers go with it, but we talk about in all of my classes and different mental health spaces that is an issue where like men just historically is not, I don't know if that's the right word, but like just they just tend to, less men seek services than women because of all that stigma. And Dr. Mitchell said several times throughout this episode, it's okay to speak with someone. Like I would ask her a question and she'd be like, it's okay to speak with someone. Like just that like simple answer of like, we just need to have that conversation. It's okay to speak with someone, and having that conversation with men too. Like it doesn't take anything away because you're going to therapy. It doesn't ruin any of that. Actually, it'll help you work through whatever's going on, and you know, maybe it'll change things for you a little bit, but in a better way. So I appreciate you bringing that up too, because it brings up on those sides more of like, you know, we talked about a lot of race and ethnicity in the first episode, but it brings in more of those other things she was talking about where culture is everything. So I appreciate that. You also said too, and I thought this was interesting, and it like they relate, but they don't relate. Sometimes people say words and my brain's like, this other thing happened. So you said parent in there, and it was like in reference to like parents being like, you don't need to seek services for like, you know, men. But I do want to bring up something she said about parents. We had this conversation about, you know, some parents take it to heart. Like when a kid goes off to college and they start going to therapy, you know, you get that, well, is it my fault? Did I do something? Did I mess you up? And in this episode, Dr. Mitchell talks about like, if that's something your parent is struggling with, have them come to a session. Have them sit down and like understand where you're coming from. And I thought that was powerful because I had never like thought about that concept before, where you can like, where that's an option, you know, you're having a problem. Let's go talk about it. Let's talk this out. Let's understand where I'm coming from. Let's understand why I'm in therapy. Let's help you see that it's not all your fault, but all of this is going on and I just need to talk to someone. So I just wanted to do that too, because you said parent and I was like, I forgot about this part.
Yeah. And that was another part that I was definitely going to bring up because I loved that. And I don't know, I feel like I've seen both sides of that coin. Like my parents were the ones who initially put me in therapy when I was a lot younger. Because when they got divorced, they had both my sister and I go see a therapist to like talk to a neutral party and just like make sure that we were doing okay. So like obviously they support it because they were the ones who made that decision in the first place. But even pursuing like counseling and psychiatry up here, there's definitely been like some tough conversations that I've had to have with them of like, they're like, I didn't know this was going on in your life. Like, I didn't know you were struggling with this. And I do think there may be some guilt there of like, this is my child. How did I not know this? Like the same, did I cause this in any way? Like that sort of thing. And so I feel like something that going to therapy is and talking about it has definitely helped with is those tough conversations. And I feel like once you speak about it and once you assure them, it's like, you did not do this. Like you did not cause this. It is okay. Once you have that conversation, I do think it helps to alleviate some of that guilt, but it's hard, especially when it happens in college and you're further away and they're not interacting with you on a daily basis and picking up on maybe some of those smaller cues of like, I'm not doing great right now. Like I'm not doing great. And then all of a sudden they're like, I had no idea. So I think college just adds even more complexity.
It does. And I think too, like along those lines where like, and obviously this isn't always the case because everybody's different, but I think that like, if you're in a spot where you're talking to them about the fact that you're in therapy for these reasons, I think that also should show growth a little bit to them, you know, like I'm coming to you with this, I'm telling you it, because nobody is entitled to know what you're talking to about your therapist about. And so if you're talking about it outside of therapy, then there's some sort of like growth there, you know, bringing it up and talking about it instead of keeping it in. So I think there's just so many angles that can come from. Yeah.
And it's just furthering the whole culture is ever present because that's even another piece. It's like age, race, ethnicity, yes, but also just upbringing in general. And
Yeah.
your parents' views definitely dictate your own.
Mm-hmm. Well, and when it comes to upbringing too, like you said, your parents' views, they're, you're going to hear your whole life how your parents feel about therapy. People who are in therapy, people who are taking, certain medicines for whatever they might be diagnosed with. And it's really hard to be someone who's in that more negative upbringing towards that stuff and then go to therapy. Like, that is such a big step to do that.
Yeah.
And then there's also fighting that generational stuff of like, are your parents saying the things they're saying because their parents said it? Are you the first one in like 4 generations
100%.
to even seek mental health services? Like, what is it like there? So yeah, there's so many different pieces to it. I don't know if I have anything else necessarily written down, but if you do, we could definitely keep going into more things.
The one other thing that I had, and I know this is something you kind of emphasized in the first episode, was just being grateful that you brought up like very real examples of like what happens in a session. I thought that was great, because I do think that's just like a kind of human fear, or maybe I'm just a really anxious human, but I do that in like different aspects of my life. Like, if I'm going to go try a new yoga studio, I'm like, do I need to bring my own mat? What do people wear? What does the space look like? Where do I park? Like, just all of these things. And I think the same exists for any situation that maybe you're a little unsure of. And so taking that first step, going to that first appointment, you're like, what are they going to ask me? Are they going to ask me to like break down every relationship I have in my life? Are they going to sit here and just like pick apart my life piece by piece? Like, what is going to happen? And so some of the phrases that she mentioned and the questions, I thought that was really great. And that was just really important for people to be able to hear that from a counselor.
Yeah. And so that's something that like, it pops up in a few different episodes because it's something that's important to me. Is like, I have this huge fear of the unknown. I have such a hard time doing something if I am not sure exactly what is going to happen. And so that's like a barrier that I constantly like to name of like, let's talk about what happens when a student walks into the counseling services at their college. So just kind of like what you were doing in the beginning of this episode where you were like, they did this whole evaluation. That's so helpful to know. Maybe there's just UF that watches this and they're like, you know what? I actually think I can make that step now that you're telling me what's going on. Like, I think it's so helpful to say, this is what happened in my first therapy session. I've been in therapy for 6 months and this happened today and I had never done it before, but like, this is a new thing. Like, just like naming what you're going to go through takes away some of that fear, and I think makes it easier to take that step. I'm all about barriers and talking about them and the things we can fix them. So I love that you talked about that too.
Yeah, absolutely.
I think this headphone will not stand. I've been like messing with it this whole episode. Yeah, I think I'm good. Unless you have anything else you want to talk about, then I think
we covered all the bases. This was like a really great episode. I feel like you talked about such a variety of things and you got some really good conversations, and I really enjoyed it.
Yeah, I loved this episode, I think, just because, we talked about cross-cultural stuff, but she just went so in-depth about, therapy, and it was more informative process, like you said, than anything else, which I thought was super helpful.
Yeah.
And then also, like, those more, like, conversations on destigmatizing. This is the second time I've tried to say that word, it didn't come out right. But, like, taking away that stigma from things, that'll work. And what's it like in Christian spaces and things like that. So I'm very thankful to Dr. Mitchell for doing part 1 with me. If you guys haven't seen it, you should go back and watch it. And thank you to Tess for being here today. So thank you.
Absolutely. Thank you for having me.
Yeah. So thanks for watching. Bye.